a very peculiar and unique group of people. I mean, you can't describe them as children, and then you can't describe them as adults. Exactly. So they are a unique group of people, and then add to the mix puberty, the confusion and drama that puberty changes bring. Adolescents need streamlined healthcare services that is particular for them. And so today UNICEF reports that young people are among the populations that is at most risk of contracting HIV, and the group less likely to have access to treatment. So we have them, they are at most risk, and then they are less likely to receive treatment because they are mostly overlooked. They are that overlooked part of the population.
Okay, you said something about streamlined healthcare services. What do you mean by that?
So what I mean by that is that healthcare services for adolescents cannot just be general. They can be treated with the same way we treat healthcare for the rest of the population.
So it should be specialized.
Exactly. So healthcare services for adolescents has to be sensitive to adolescents. Remember I said that they're not children and they're not adults. Exactly. So they're in that space in between. And so UNICEF also reports that we have 1.2 million deaths of adolescents each year from preventable causes, from the fact that they couldn't access these healthcare services. So what are the healthcare tips for them? When we look at health, we're looking at physical health, we're looking at sexual health, we're looking at mental health, and these sections of health are not standalone, they're intertwined. So your physique somewhat affects your sexual health, and it also affects your mental health. So when we look at the tips for them, I think the utmost and the top on the tip is good nutrition and healthy lifestyle. So young people need good nutrition. They need good food, basically. and they need to keep fit.
Who doesn't?
And they need to keep fit. Practicing safe sex and use of contraceptives. So yes, young people need to be told about safe sex, the measures with which they can practice safe sex, and the contraceptives available for them, because young people will be engaging in sex. They are exploring, they're going through puberty, there's changes in their body. So we need to have a society that is open to talking about it with young people. And then clean practices of menstrual hygiene for AGYWs. So AGYWs are called adolescents, girls, and young women. They need to be taught, and then they need to be provided with resources to practice clean and safe menstrual hygiene. Yes, and we also need to be sensitive to them. So there's a lot of stigma around menstruation. So we need to be more open to letting them know that menstruation there's nothing shameful about it. And then we also need to provide them with the resources to properly and hygieneously menstruate. And then the use of primary healthcare services. So primary healthcare services are available in almost every local government. So we need to help young people know that it's available for them and they can use healthcare services. And then healthcare tips: seeking immediate treatment. In the event of being infected with a disease, they need to know that there's no stigma around seeking immediate treatment. Like, go and get treatment. If not, you would get worse. Yeah, so these are some of the tips for young people.
Okay, so where does this training start from? I mean, who should be the first in the ladder of the stakeholders giving out this information, and where does it stop?
So we know that in society we have family, we have the media, we have government, we have communities. So the training should take place in communities. It should take place in families. And if families are not aware, if families are not aware, then this training should also be taught in schools. So there's something that the Federal Ministry of Health describes as the information, education, communication. And then actually there's a national guideline on integrating adolescent-friendly health services into primary health care. And so they said, they're going to do IECs. So IECs means they're going to have information, education, communication for young people. Health officials are going to be going to schools to talk to young people about their health and how they can, better take care of their health. And then there's going to be community outreaches. They're going to be talking to parents and, members of the communities on health and how to take care of their health. So this is where this training should come in for young people.
Okay, let's take it one after the other. Let's start from the family, the parents. In our society, quite a number of parents are not comfortable speaking about sexuality education with their children, whether male or female. So how do we break the genes? How do we make them? After all, there were ones like them. I mean, they didn't grow up to just become a parent in a day. Why do they find it difficult?
Well, our culture promotes this whole
Denial.
exactly, that's the
Secrecy.
word. Denial, secrecy. You know, let's not talk about it. Let's not talk about sex. They don't want to talk about sex. In fact, so I work with BSI, and we've been doing this comprehensive sexuality education program for young people in Lagos State, in 2 schools. And when you get to ask these young people questions, so what are your parents saying? They say, don't go near a boy. They don't. If you touch a boy, you get pregnant. Exactly. You know, so there's a lot of, and it comes from if we look at the intentions of parents, they are well-meaning. They want their children to avoid teenage pregnancies. They want their children to,
But
be
it's
safe.
just not in tandem with present-day realities.
Yes, so young people are learning about sex. Young people will explore. So it's either they learn from home or they learn with their peers. And sometimes learning from your peers, it's not guided. All of you are exploring together. You guys are exactly.
In the land of the one
of the blind, the one-eyed man.
That's the
Exactly.
thing.
So all of you, and it's not really guided. So
like a
parents
trial and error.
Exactly. But there are organizations, at least I know BSI is doing something around that. I know Peace of My Heart Foundation is enlightening parents. You need to talk to your children about sex, no matter their age. Talk to them about it. Let them be comfortable to tell you.
But some parents will tell you that if you start such discussions, you're exposing them too early to want to explore.
So this is where balance comes in. So this is where balanced communication, informing them of what is possible. So there are hormones in your body, you will feel a certain way, but this is the reason why, you should pursue abstinence. These are the benefits of abstinence for parents who want their children pursuing abstinence. And then for young people, so most health officials won't, impose abstinence on young people. So they tell them about safe sex, safe practices. Okay, if you're going to have sex, these are the contraceptives that you should use. These are the ways to protect yourself. We need to get young people open, but preventing, the need to explore, the need to want to find out what sex feels like. You can only combat that with telling them about the benefits of abstinence or the benefits of prolonging until they are ready. But will they explore? Of course they will explore.
You mentioned the menstrual circle in our society, where some people will say, ew, it's dirty. How do we, even sometimes the way the parents put it across to their children makes it so. They're like, you've committed an offense.
Yeah. So we go to schools and we talk to young people. There's no stigma with menstruation. Menstruation is natural. Menstruation is biological. Menstruation is a power. If you do not menstruate, you cannot bear a child. And so that's a natural process. It's not, and I didn't choose to menstruate. It's not like I said, I didn't choose it. You didn't choose it. So be comfortable with it. And understand that it is completely natural. It's the way you have been designed. It's the way your body works. So there's no stigma around it. The more we create awareness, which is one thing we often strive to do, the more we create awareness about menstrual hygiene and how menstrual hygiene management should be incorporated into society, the more we get people comfortable with it. So people think it's ill because in their head, why are you bleeding? So that's all the image they have. But if they know that, okay, this is a biological process that needs to happen, and I think they'll be more comfortable.
Why do we hide from talking about it? You have girls are going through the menstrual cycle, and then you ask them, so you're having stomach cramps and all that. I ask them what's happening. They go like,
because they already know that if they tell somebody, I'm on my period, the person will most likely be and so they're not comfortable. They don't want to be stigmatized, so they won't be comfortable.
Did you suppose such information? We talked about information, education, and communication. The IEC should be given to the male adolescent too, so they understand when a girl child is going through this certain stage, he knows how to help instead of castigating the person.
Definitely, if we leave out,
because we've not been balancing it. We only talk to the girls, we leave out the boys, so the boy is confused, doesn't know what to do.
if we leave out the boys, that response is exactly what we would continue to have. We'll continue to have a stigmatized, confused, ugh, they won't know how to respond. But boys are empathic. Actually, they are not brutal, cruel human beings. They're empathic if you explain to them. If you explain to them, they will know how to respond. But because we avoid talking about it altogether, and then they respond the way they have been presumed, yes, to respond.
All right, so how accessible those healthcare tips you mentioned earlier? They're really accessible in Nigeria. I know in some countries, actually, sanitary towels are actually free for girls. When are we going to get there in Nigeria?
Well,
sounds funny, isn't it?
yeah, I know that some civil society organizations are doing a lot to advocate. We should even have days where women who are on their period should not go to work because it's a big deal. We should have provision of pads in every offices. There's a lot of...
Since when we go for events, to go to the hospitals, the CDs are given out free. Why not sanitary towels?
Well, we're
Which
getting
is
there.
safer, which is easier.
Yes, so this is why we need to even keep pushing for awareness and keep advocating for things like this. So how accessible are healthcare facilities? Well, I know that the government, as Lagos State government, for instance, has made available Hello Lagos. So there are Hello Lagos centers. Hello Lagos is a youth-friendly, adolescent-friendly center for sexual health. And so adolescents are supposed to walk into Hello Lagos and get the help that they need. But how many adolescents are even aware that things like this exist? So how many... So UNICEF or the Federal Ministry of Health says that 80% of primary healthcare facilities or of healthcare facilities are PHCs, primary healthcare facilities, and that they service 70% of the population. And it's true, because if you go to every local government, you'll find a primary healthcare facility. But as an adolescent, am I comfortable enough to walk in? Is there sensitive consultation for me if a teenager with an unwanted pregnancy walks into a PHC, for instance? Would they be comfortable enough? Exactly. They would feel very stigmatized, and then the nurses or the doctors would look at them with, oh, look at you, spoiled child, how old are you? The kind of service and treatments that they need will not be made available for them. So these are some of the barriers to access of healthcare facilities. Young people don't even want to go there. One, they may not be aware. Two, even if they are aware, they don't want to go there because they think of the fact that, before nobody understands. And then for adolescents who want to practice safe sex, for instance, before I go to get a condom, if I walk into a pharmacy, how are they going to look at me? If I want to purchase contraceptive, for instance, how would I be perceived?
What do you want to use it for at your age?
So there's going to be a lot of questioning before you even... I'm coming with my money, I want to buy it, but there's going to be a lot of questioning and a lot of stigma. So these are some of the reasons why young people don't even access healthcare services in the first place.
Okay, so now let's bring it down on the service providers themselves. Are they well informed to handle situation? People have this ideology, some people, that when you go to certain health facilities, the way they react to you is enough for the sickness to return. So are they even well informed? Because I may be different. My own manner of approach, the way I want people to speak with me, may be different from the way they can reach you. But what we do here, we just generalize. Do they understand that much from your experience?
Well, I would say that on paper, if you go online, no, I'm coming there. If you go online, you try to see, what's it like in Nigeria? They will tell you, we're training our consultants, we're training our facilitators, we're training them to be able to provide better healthcare services. But if you walk into a physical healthcare facility, there's a lot of, you won't even understand. Why are you hungry? It feels as though their presence or your presence is frustration for them, and there's harsh treatment. And I'm sure these are some of the reasons why young people don't even go to these healthcare services. Because even for sick adults, you get treated anyhow. They push you, wait, just sit down, the doctor is coming, or just, they're not friendly, they're not warm, they're not empathic.
Lagos State is improving.
Yeah, Lagos State is improving. Like, just
Yeah.
take it
What
easy for
about the
them.
school front? I know then they have sick bays.
Mm.
Some have clinics, mini one. Then they have mommy nurse and daddy nurse. Would you say that is adequate? I mean, you visited some of the schools. What they have there, the sick days, basically, anything happen, just lie down there.
Yeah, so most sick bays, or to generalize, except for high tier schools, most sick bays, what they have is first aid box and maybe Miss Mag, a nurse that will just treat you. But if there's anything critical, they call your parents to come and carry you, because because it has gone beyond their power. So being able to respond to the needs of adolescents in schools, there's not proper provision for that. You won't find, there's no proper provision for that in schools. So the most standard, you will find a first aid box. You will find, and if you get injured,
So counselors.
well, counseling is a completely different ball game entirely, because you're not sure is your counselor sensitive enough? Is there really confidentiality with or will they come to the assembly ground and then you are the object of discussion? Some of you, your mates, some of you are already sleeping around. We are talking to you. How comfortable are young people in schools? I wouldn't say very comfortable.
Right then. Rachel, on the last note, what would you like to say to parents and then to the government about the issue of practical healthcare tips for adolescents and young people?
Well, to parents, I'd say be open. I mean, every parent was once a young person. It feels as if people grow up and they just forget, or they they get amnesia.
No, that part is erased.
Exactly. It's as if they just all of a sudden get amnesia, as to how it felt like to be an adolescent. Be open and be your child's friend. So let them come to you. They will have these issues. It may not even be them. They may witness their friends having these issues. Let them come to you. How open are you to help a child if, for instance, your child gets an unwanted pregnancy, or your child is the reason why another child has an unwanted pregnancy? How do you deal with that? So parents should look for resources. Parents should look for resources that would help them handle these things better. And if you go to VSI, if you go to Peace of My Heart Foundation, you will find these resources there. To the government, there's a lot of work. We don't just need paper recommendations or resolutions. We don't need guidelines of how you want to integrate friendly health services into healthcare. We actually need real implementation. So when young people go to these healthcare services, are your service providers really trained to manage these issues that come with adolescents and young people?
Okay, and what about to the adolescent themselves? What do you have to say?
Well, to the adolescent, I'd say stay safe, be smart, be wise. At the end of the day, it's your health. At the end of the day, it's your body, and if you're not healthy, you won't be able to live a good life. So stay safe. Always look for more awareness on your health and how to improve your health. Always reach out. In case you even contract diseases, don't be shy. Go for the help that you need. Even if today we are still progressing, but go and get the healthcare that you need and ensure that you are safe. And also tell other young people that they should stay safe as well.
All right, and Rachel talked about the Early Lagos. The Early Lagos is about creating a society where every young person in Lagos State